All right, in this video I wanted to introduce you to shoulder impingement syndrome and how we try to treat this in the clinic with acupuncture and Chinese medicine. So shoulder impingement syndrome is when there is an impingement of tissue in the shoulder, particularly with overhead movements. And there's another video where we'll cover the tests that we do to identify the shoulder impingement. But essentially the tissue's impinged, usually the supraspinatus tendon is jamming in between the bones there. The bursa might also be involved, so there might be inflammation of the bursa. This is usually coming about from an imbalance in the rotator cuff muscle, so it's important that we address any imbalances there that is allowing the head of the humerus, or the top of the shoulder, to rise up into that joint capsule there. So with acupuncture, what we're trying to do is, first of all, we need to identify what's causing that impingement or closing that joint space. And then we need to go about addressing those imbalances. So we've got to identify if there's an imbalance in the rotator cuff muscles. We're going to use acupuncture to try to create more balance through there and better movement. We're going to use acupuncture to try to decrease any inflammation that there might be around the tendon or around the bursa, so that again we get a little bit more space. Now, how we do that, in the initial treatments we're typically using a distal style of acupuncture, which means we use points distant to the affected area. So for us that means we'll be using points on your foot, leg, hands and arms. Doesn't make a lot of sense until we start using it and getting some changes there, but the idea is we're using these points to tell the brain to start to open up the circulation and heal that area. Now as you progress, or if we feel like we've got some improvement but we get a little bit stuck, we may start to incorporate also some local acupuncture down the track. So local acupuncture is where we will go into the local tissue. Usually by this point it's less painful and it's less sensitive, so it's safer to needle into this area. The reason we start with the distal is if we go straight into an inflamed tissue, good chance of flaring it up and making it feel worse. So we try to avoid that in the beginning, try to wind things down, get things feeling better, and then if we need to, we'll go into the area to address those imbalances further and promote the healing further. So with the acupuncture treatment, we need like an accumulative effect, so we need a few sessions together to see if we can build up that effect. But as long as we're seeing improvements within the first 4 to 6 sessions, we know we're on the right track and we should be able to get you feeling a lot better. We may also combine Chinese herbal medicine as well. This is really useful to treat the body as a whole. There's certain Chinese herbs that we would include to help promote circulation to the upper part of the body, like the shoulder, as well as just wind down the nervous system and help with the pain side of things. And then the ultimate goal is to get your pain reduced enough and your range of motion increased enough to start to do some more rehabilitative exercises and really strengthen the muscles through there and create more space and longevity for the joint there. If you have any questions, please don't hesitate to look us up online, villageremedies.com, and drop us a line. Thanks.